So the vaccine that we're working on involves creating a hybridoma or fusion cell between patient-derived myeloma cells and their own dendritic cells. So it's a personalized vaccine. The notion is that the vaccine presents a broad array of antigens, including neoantigens, in the context of dendritic cell co-stimulation. And we've shown in earlier studies that we can generate a broad and sustained T-cell response. And in a study looking at patients undergoing vaccination after transplant, we were able to nearly double the complete response rate after transplant between day 100 and 1 year out without any other maintenance therapy. Based on those data, we then embarked on a multi-center national clinical trial that we're conducting through the CTN, which is one of the cooperative groups for transplant in the US. We had a design where patients who were transplant candidates had their tumor collected up front. They then went through induction therapy, transplant, and then in the post-transplant period were randomized to either get our vaccine plus lenalidomide maintenance versus 2 control maintenance arms. The trial has been very vigorously enrolling. We are actually completing enrollment this week of a little over 200 patients. And so we're very excited to see what the data shows us. We've been exploring this vaccine in other settings, including acute leukemia, where we were able to show that in patients who were at high risk for relapse, who had chemotherapy-induced remission but were not transplant candidates, that with vaccination, over 70% of those patients stayed in remission at 5 years out, which was pretty dramatic. And then we're now conducting, similarly, a randomized trial in that patient population looking at vaccination compared to best supportive care after achieving remission. With regard to myeloma, we have another study that's coming out now that's being initiated, including a combination of our vaccine plus a checkpoint inhibitor in patients with relapse disease, and very interested in what the results of that will show. And we have a lot of integrated science, both in the CTN study and in that new myeloma study, looking at the effect of vaccination on the immune repertoire, and also trying to understand some of the aspects of both the tumor cell and the microenvironment and how that predicts response. Finally, in an effort that we have with the MMRF, we have a joint collaboration with Michelle Sadeline's group at Sloan Kettering, at Tuna Mutis and Maria Tomelli at VU in the Netherlands, to look at the combination of our vaccine plus CAR T cells, with the idea that the vaccine may be able to create a broader immune repertoire for the CAR T cells and also create better persistence, and that may get around some of the issues that we know are potential sources of recurrence in that setting.